Some patients come see us particularly because they'd like a certain gender baby, so they'd like to undergo gender selection. And there's a couple different ways to do that. And really what I tell patients, the way they should decide to pursue it depends upon what their priority is. Some patients their priorities wind up achieving pregnancy, but they'd really love it if it could be a boy or a girl in particular. And in those cases, we have sort of lesser aggressive approaches to do that, which I'll describe. Some people have a certain number of kids, all of one gender, and would really rather not be pregnant if they couldn't be pregnant with a particular gender baby they would like to have. And so the different technologies we have, the sort of lesser aggressive approach, is by taking sperm and processing them through a certain spinning technique, which separates out, to some extent, the boys from the girls. And during woman's ovulation, we can take those sorted sperm and we can do something called an intrauterine insemination, where we put the sperm inside the uterus at the appropriate time that coincides with ovulation. Now that technique, the sperm spinning technique, will improve the odds of getting the gender they desire, but it's not foolproof. And so in general, it's about a 51% chance of having a girl, 49% chance of having a boy. With doing sperm spinning for gender selection, we can get into sort of the mid 70% chance, maybe 75% chance of achieving the gender type of pregnancy that they'd like to have. The more foolproof technique is really doing all our high technology things like in vitro fertilization. Because with in vitro fertilization, we stimulate a woman's ovaries, so it's more aggressive. We collect her eggs. They go with husband's sperm and lab and form embryos. We can then, when the embryos have grown and developed for about 3 to 5 days, we can take a cell out, and we can assess the embryos genetically, and not only determine, we can also look at all the chromosomes and make sure they're chromosomally normal, but also determine if they're boys or girls. And then we can pick the appropriate gender and do an embryo transfer, and the chance of that achieving the pregnancy with the kind of gender they want is essentially 100%. So there's different ways to do gender selection. Which one you pick really depends upon your priority.